There's no question we are all on the run during these summer months, but painful vein disease can actually slow us down. We're happy to have back Dr. Robert Cutchen, founder and director of the Albuquerque Vein and Laser Institute, and he's here to tell us how we can learn to love our legs again. Oh, Dr. Cutchen, I want to love my legs. I hate when I see little things that make me worry.
It's true. Vein disease is so common, and it's almost everybody has a little bit of spider veins or varicose veins, and the good news is that nowadays it's become so easily to treat. So that's my favorite thing about it.
I love to hear that, and I think so many people watching, as I'd mentioned, they get self-conscious about it. So it's nice to know you're not alone. And last week we spoke about the signs and the symptoms of varicose veins as well as spider veins. We talked a little bit about the difference. Right. So let's just remind our viewers a little bit about the disorders.
That would be great. So it's important to understand the role of our veins. And if you look at this graphic, it reminds us that the role of our veins is to carry the blood back to our heart. And when we're talking about out of our legs, the blood should only be flowing up. So inside, as this graphic shows, inside of our veins we have these valves that open to let the blood flow up. And then in the next graphic, you'll notice how these valves close as gravity pulls the blood backwards.
Which we really can't control that part of it. The gravity is gravity.
That's right. And luckily we have these valves so it keeps all the blood from going down to our feet. But unfortunately, in a varicose vein, these valves are broken. And the result is that gravity wins and the blood flows right back down that vein. That puts a lot of back pressure and congestion in the vein, can cause them to bulge out. And that's really the problem, is that these veins aren't working right. They're letting the blood flow backwards towards your feet instead of up towards your heart. And that's what causes the symptoms that we talked about last time, causing people to feel, mostly it's kind of a sensation of heaviness, aching in their legs. Some people will feel throbbing, burning, itching, a whole variety of symptoms. And it's just kind of a general discomfort. When I ask people if their legs hurt, it's not like if you have a big accident and you break your arm. It's not that kind of pain.
It's a different kind of pain.
It's just more of a heavy, achy, tired feeling in your legs.
Like a pressure too, right? A little more of a pressure than a pain.
It sure can be.
Well, and you also mentioned, which I think people will really appreciate, is that you offer free vein screenings. And I think that's really nice to know. So let's let everybody know what's involved in those screenings.
We do these vein screenings, and they're about 10-minute long appointments. And we have patients come in, have them fill out a brief medical history form. And we just review some of what they're feeling in their legs, if they're having some discomfort or if they're not. And I take a quick look at their legs, and we try to figure out if we're looking at more of a cosmetic problem like these spider veins, or if we're looking more at a medical problem that's going to be causing some symptoms, may have some bulging veins. And those are the patients who we route through our full evaluation. And fortunately for those patients, their care is actually covered by their insurance. So that's the best part.
Well, that's really good to know. And I want to ask you a little bit about the role of the ultrasound, because you said that you go to the next step in evaluation when you notice the bulging. So what does that process involve?
Well, we really have to figure out, as we talked about before, if the veins are working right. And the only way to know that is with an ultrasound. And on the ultrasound, like you can see here, we do it with the patient standing up, and that lets us test their veins against gravity. Is the blood flowing up or is it flowing down? And as we do this, we're essentially able to create almost a 3D map of their leg veins, saying this is where the problem's starting and this is where it's going. And that's what allows us to be very thorough. Without ultrasound, we're almost blind nowadays. We rely on it so extensively because it really allows us to be very thorough and very careful when we're doing our treatments. We also use it in almost all of our treatments.
Really? And it looks painless, which is a nice thing too, eliminating a little fear for people.
Yeah, it really is.
And who would you recommend should actually have their veins treated?
You should have your veins treated if you're having discomfort in your legs, this heavy, achy, tired feeling. That's our #1 motivation. We're going to talk on another visit about more advanced varicose veins that can actually damage your skin, much like smoking can damage your lungs. And there are some people who need to have it done to protect their skin, but for most people it's just about helping your legs feel better.
But you can also treat for cosmetic purposes as well, correct?
Right, and those we're talking about, those smaller spider veins. That's of course not covered by insurance, but those we really can get rid of those red and purple veins and make your legs look better when you're wearing those shorts or skirts.
That's good to know. Okay, so when it is a medical problem, when you get to that point where you've evaluated and you've come to that conclusion, that's when insurance will cover it. So that's a great thing to know. And then if it is cosmetic, then that's something you'll have to save up for on your own. But let me ask you this, where are the treatments performed so people know what kind of time commitment and what kind of, where they need to go as far as what's involved?
That's the good news. In years past, everybody had to go to the hospital to have their veins treated. And usually they were asleep in the operating room under general anesthesia. And nowadays, everything is done in the office under local anesthesia, which means our patients are awake, we're listening to music and just talking. And after everything we do, you're immediately back on your feet and back to activity. I want to tell you a little bit about the treatments that we do nowadays.
Please do, yes.
In years past, the veins that were treated with vein stripping, we actually don't do anymore. Those veins are actually now treated with a laser, and we have a long, thin, very small laser fiber, which we actually place up inside of larger and longer straight varicose veins.
Okay.
And we're actually able to use this laser to, we actually put some local anesthetic in and numb this vein up. And then we and then we burn this vein with a laser.
Okay.
Leave the vein in your leg, and over the course of about 6 months, it just disappears like a scab or something.
On its own.
Yeah.
Interesting.
And so those are the veins that were previously treated by stripping, which was a very uncomfortable procedure. So that's one way.
Okay.
When people have those bulging veins on your legs, in years past, you would end up with large, about inch-wide incisions sideways across your legs. We now treat those with very small, about 1/8-inch long vertical incisions, and we hook those little veins and actually pull them out. It sounds kind of gross and painful.
Yeah.
But it's really not all that bad at all.
Okay, I trust you if you say it's not
But when
bad.
you're done with that, all those bulging veins are gone, your leg is smooth again, and after about a year, you literally can't even see those scars.
That's great. So side effect-wise, is there a lot of recovery time? Are there a lot of side effects after the fact?
Very, very few. You know,
Good.
we don't prescribe anything stronger than just ibuprofen for recovery as far as pain goes. So our patients are immediately back on their feet. They're back to work the same day or the next day.
That is so comforting, Dr.
Yeah.
Cutchen, because I think that's one of the things people worry about with any kind of treatment in any area of their life.
Yeah.
And so that makes things a lot better. And I want to let all of our viewers know exactly how they can reach you
bet.
if they are dealing with this situation in their own personal lives.
You bet. The easiest way to get us, of course, is by phone at 848-VEIN or 848-8346. And a lot of these questions are addressed on the web at albuquerquevein.com.
Oh, good. Very good to know. Well, Dr. Robert Cutchen, I know you'll be back with us again to get into a little bit more into it in advanced form.
Yes.
And so I appreciate that. But in the meantime, really great advice, great information, and I think everybody knows where to go if they have any kind of issues with varicose veins.
Thank you so much.
Thank you so much. And stay with us because we're going to learn a thing or two about looking good from E! News host and reality star Juliana Rancic.